Hello, ma'am.
May I know your name and age, please?
My name is Snithu Reddy. My age is 50 years.
Okay. So, do you feel like any head pain?
No, ma'am.
Okay. Do you feel any muscle pain or weakness?
No, ma'am.
Okay. Do you feel like any dizziness?
No, ma'am.
Okay. Now I'm going to examine your cranial nerves. Is it okay for you?
Okay.
Okay.
Begin by inspecting the cranial nerve 1, that is olfactory nerve. First, make sure that each nasal passage is patent by compressing one side of the nose and ask the patient to sniff through the other. Then ask the patient to close both eyes, occlude one nostril and test smell in other with substances like cloves, coffee, soap or vanilla. Normally, the patient perceives odors on each side and identifies them correctly. For cranial nerve 2, that is optic nerve, test the visual acuity. To test the acuity of central vision, use a well-lit Snellen chart if possible. Position the patient 20 feet away from the chart. Ask the patient to cover one eye with the card and read the smallest line possible. Now, test the visual fields by confrontation. The first one is the static finger wiggle test. Position yourself about an arm's length away from the patient. Close one eye and have the patient cover the opposite eye while staring at you open eye. Place your fingers about 2 feet apart of the patient's view, roughly lateral to the patient's ear. While in this position, wiggle your fingers and slowly bring your moving finger forward in the patient's center of view. Ask the patient to tell you as soon as he sees your fingers. For kinetic red target test, move an 5 mm red top pin inward from beyond the boundary of each quadrant along the line bisecting the horizontal and vertical medians. Ask the patient when the pin first appears to be red. For cranial nerve 2 and 3, that is optic and oculomotor nerves, inspect the size and shape of the pupil and compare one side with other. Also, check the near response, which tests pupillary constrictions, convergence, and accommodation of the lens. For cranial nerves 3, 4, and 6, that is oculomotor, trochlear, and abducens nerve, test the extraocular movements in 6 cardinal direction of gaze and look for the loss of conjugate movements in any of the 6 directions which causes diplopia. Check the convergence of the eyes. Identify any nystagmus, any involuntary jerking movements of the eye with quick and slow components, and also look for tosses of the eyelids. For examination of cranial nerve 5, that is trigeminal nerve, while palpating the temporal and masseter muscles, in turn, ask the patient to firmly clench the teeth. Note the strength of muscle contraction. And then ask the patient to open and move the jaw from side to side. This is motor part of the examination. To test the sensory part, explain the patient what you are planning to do. Test the forehead, cheeks and chin on both sides for pain sensation. Use a sharp object and blunt object such as a cotton swab. While testing, occasionally substitute the blunt end for the point as a contrasting stimulus. Ask the patient to report whether the stimulus is sharp or dull and to compare sides. If you detect sensory loss, confirm it by testing temperature sensation. By using 2 glasses filled with cold and hot water, touch the skin and ask the patient to identify whether it is hot or cold. Then test for light touch using a fine wisp of cotton. Ask the patient to respond whenever you touch the skin. Now test the corneal reflex. Ask the patient to look up and away from you and approach from the opposite side out of patient's line of vision. Avoiding the eyelashes, lightly touch the cornea with fine wisp of cotton. Inspect blinking of both eyes, the normal reaction to the stimulus. To test the cranial nerve 7, that is the facial nerve, inspect the face both at rest and during conversation with the patient. Note any asymmetry often visible in the nasolabial folds and observe any tics or other abnormal movements. Now ask the patient to raise both eyebrows, frown, close both eyes tightly so that you cannot open them. Test the muscular strength by trying to open them. Show both upper and lower teeth and smile. Puff out both cheeks. To test cranial nerve 8, that is acoustic and vestibular nerve, assess the hearing with whispered voice test. Ask the patient to repeat numbers whispered into one ear while blocking or rubbing with your finger next to the contralateral ear. If hearing loss is present, determine if the loss is conductive from impaired air through ear transmission or sensory neural from damage to the cochlear branch of cranial nerve 8. Now, test for lateralization using the Weber test. Place a lightly vibrating tuning fork firmly on top of the patient's head or on the mid forehead. Now ask the patient whether he can hear vibrations in one ear or both the ears. Now, test for air and bone conduction using the Rene test. Place a vibrating tunic fork on the mastoid bone posterior to the ear. Ask the patient when he can no longer sense the vibration. Then swiftly place the tunic fork near the ear. Usually, the air conduction is greater than the bone conduction. To test the cranial nerve 9 and 10, that is glossopharyngeal and vagus nerve, listen to the patient voice. Is it hoarse or does it have any nasal quality? Note if there are any difficulty swallowing. Ask the patient to say ah or to yawn to watch the movements of the soft palate and the pharynx. The soft palate normally rises symmetrically. The uvula remains in the midline. Each side of the posterior pharynx moves medially like a curtain. Warn the patient that you are going to do the test, the gauge reflex, which some patients may refuse. This reflex consists of elevation of the tongue and soft palate and constriction of the pharyngeal muscle. Stimulate the back of the throat lightly on each side. In turn, observe the gauge reflex. By standing behind the patient, look for atrophy and fasciculations in the trapezius muscle. Now ask the patient to strut both shoulders upward against your hands. Note the strength and contraction of the trapezi muscles. Now ask the patient to turn his or her head to each side against your hand. Now observe the contraction of the opposite sternocleidomastoid muscle. Now test the cranial nerve 12, that is the hypoglossal nerve. First, listen to the articulation of patient words. Inspect the patient's tongue as it lies on the floor of the mouth. Look for any atrophy and fasciculations. Then, with patient's tongue protruded, look for asymmetry, atrophy, or deviation from the midline. Ask the patient to move the tongue from side to side and note the symmetry of the movement. Then ask the patient to push the tongue against inside of each cheek in turn as you palpate externally for strength.